Assalamu alaikum. I'm Dr. Muhammad Mohsin. In this video, I'm going to explain one of the communication skills stations. The name of the station is regarding counseling a patient before stopping warfarin. As we said before, this is just a conclusion of the preparatory station that you will find before the station of communication skills. As we have seen in the previous videos, each station in the communication skills stations tests something. In the first station, we had some knowledge regarding self-discharge procedure or DAMA. Also, we had some knowledge regarding how to take consent to a procedure from the patient. Also regarding dealing with anxious mother, what to do when there is a possibility of child abuse. This station is testing one important communication skill, which is how to counsel a patient about his condition. And this is very important skill, not only in the exam, but as you, for you as a doctor. Counseling a patient is one of the skills that you must have. Okay, so let's go directly to our station. First, the preparatory station. You will find in the note of preparatory station that the patient is an old patient. This old patient presented with recurrent inguinal hernia. The consultant decided to perform an operation for hernial repair. The patient had a prosthetic valve, he had a prosthetic valve replacement about 20 years. Since then, he is being on warfarin, and as you know, warfarin is an oral anticoagulant. So he is on warfarin, and now the consultant told him that warfarin is going to be stopped before surgery. On admission, the patient refused to stop warfarin, as his cardiologist told him a long time ago not to ever stop it. The nurse called you to talk to the patient. So the patient is taking a medication and he refuses to stop it. What is the task? Your task here is to counsel. Counsel the patient on stopping warfarin and start low molecular weight heparin, and you have to reply to his questions and explain to him the cause to do so. So as we see, you have to counsel him and you have to answer his questions. So it is important to know that in this station, most probably the actor is an old age male wearing a black glasses sometimes, and it is written in the notes that the patient had a history of macular degeneration and he is almost blind. He is using a walking stick. And what is the importance of this note? This is when you are dealing with a blind patient, you have to convince him only by your words, because he can't see you. And also regarding what will come in the station later on, if he will be available to take any home medication or not. Also, macular degeneration or any problem in the eye may have some interaction with the anticoagulation. Sometimes you have to take a consultation from ophthalmologist whether to change anticoagulation or start anticoagulation in such cases. So let's go to our station. In the station, you'll start as usual. Hello, Mr. X. I'm Dr. Muhammad Mohsin, one of the surgical doctors in the department. I have been told you have some concerns regarding stopping your warfarin pills. Could you tell me more about your apprehension towards this issue? So as usual, you start by identifying yourself, and after identify your task that you are here to counsel him, and then open questions. This is the start in almost every station of communication skills. You identify yourself, identify your task, and then open question. After open question, the actor will start to talk to you. Hello doctor, my cardiologist told me before never ever to stop my medication. I have been on this medication for about 20 years. He told me if I stop this medication I will die. So the patient has much concerns regarding stopping his medication. How to act in this situation? This is the core of the test, or the core of the station, how to counsel the patient. So you will start by appreciating his concern. So you have to say, I appreciate your concerns. First, let me explain what is warfarin and how it acts. Warfarin is a medication that thins the blood by preventing the production of certain chemicals. It is prescribed for patients to prevent the formation of clots in their body. In your case, warfarin prevents the formation of clots on your artificial valve. As we are going to operate upon you to fix your tummy problem, we have to stop the blood thinning effect of warfarin for fear of bleeding during and after the operation. Warfarin has a long duration of action, so we have to stop it 5 days before your surgery, but we can't leave you without protection for that period. So to keep you safe from formation of any clots in your body, you will be given another injectable drug which is called heparin. It will be equivalent to warfarin in its effect, but has a shorter duration of action, so it can be stopped for 12 hours before surgery. From this conversation, you explain to him the action of warfarin and what is the problem. It's a problem with surgery, and you explained the action of heparin. And this is so important to convince the patient about your task or about your mission. So the actor will start to say, okay, so what is the difference between warfarin and the injectable medication? Let me continue on my best. In this station, by the way, the actor will repeat his speech. He will repeat again and again. Let me on warfarin. I don't want to stop warfarin. Why to stop warfarin? In every time try to say the same information with some modulation. Okay, so you will start to say both of them have the same effect that prevents formation of clots over your artificial valve, but warfarin has a long duration of action. That means it will be acting up to 5 days after its stoppage, while injectable heparin is having only 12 hours of action, so it can be stopped shortly before your surgery. Now what you explained the mechanism of action of both drugs, comparing both drugs. You compared their mechanism of action, you compared their duration. So now the actor will start to say, okay, if I agree to take this injectable medication and stop my warfarin pills, will I continue to take this medication after my surgery? So now he asks about one important data regarding his medication. He will continue this medication or he will stop it. So now what to say in this question? So you will say, after finishing your surgery and after we are satisfied on the outcome and make sure that no bleeding, we will recontinue giving you warfarin tablets together with injectable heparin. After few days, we will make sure that the blood thinning effect of warfarin is regained. Then we will stop injectable heparin. So what you explained now? You explained an important process which is called bridging. And as you know, bridging is you when stop oral anticoagulant and start heparin and the reverse. This is the bridging between the oral anticoagulant effect and the injectable heparin or low molecular weight. And it is important process that you have to know, and you have to express this process in a layman language to be informative to a patient. So then the actor will start to say, okay, so I'll be admitted to the hospital for the whole period, or I can take this medication at home and then come directly to the surgery appointment. So the patient asked about the need of admission. As we read some note that the patient is almost blind and he can't see, so this will be like a background to the answer of this question. Also, you have to know that the actor will ask, as I told you, the actor will ask many questions with different ways, but in the same meaning. Okay, so you have to repeat your speech with some modulation to convince him. Also, his reaction would be refusing all the time. Okay, and he will resist for a while, but he will get convinced at the end. So don't worry from this action from his side. Also, you have to know that low molecular weight heparin, as you know, can be given at home. But in that patient, it is better to tell him that he needs to be admitted to the hospital for the whole period. Why? Because the patient has high risk of thromboembolism as he had prosthetic valve replacement. So he must be kept under close observation. Second cause is the patient had macular degeneration and almost blind, so it will be difficult for him to inject himself. So as I told you regarding the note that you will find in the patient file, this is important in replying this question, the need of admission, because if the patient doesn't have these problems, you can simply tell him yes, you can take your medication at home. Okay, but in this situation you have to tell the patient as follow: our recommendation in your case to be admitted to the hospital, so you need to be admitted at least 5 days before your operation to stop warfarin and start the injectable heparin, and also to be kept under close observation in that period. So now you replied this question in the correct way. Then the actor will start to say, okay, also I take diazepam pills as I have some anxiety. Should I stop it? And for your knowledge, any patient on diazepam for anxiety disorders, he can continue his medication before surgery without any problem. So you will tell him, so he asks about anxiety medication. So you can tell him it's okay, you shouldn't stop your diazepam pills. Even in the morning of surgery, you can take it with a small sip of water. So after some period, the actor will get convinced, and after you see that he is convinced, you will start to end of consultation. In this station, it is better when you are counseling a patient regarding something, it is important to sum up the conversation. So you will say like that, to summarize what we have been through: you will be admitted to the hospital 5 days prior to the surgery. You will stop warfarin and start injectable heparin. After surgery, you will continue injectable heparin. Then we will add warfarin. After warfarin regains its effect, we will stop injectable heparin, and then you can be discharged. So now you summarized the conversation with the patient, and the last question from your side: do you have any more questions? He will say, no doctor, thank you. You thank him, and then you finished the station successfully. I hope this was beneficial for your preparation to exam. Good luck and thank you.